Greetings from Patanjali Research Foundation. I am grateful to the organizers of the Yoga for Unity and Wellbeing Conference, and especially to Ekta Ji for the invitation to talk about the research that we have been doing at Patanjali Research Foundation, a unit of Patanjali Yogbit. So in the next minutes, I will be talking about this, and for this, I need to share some slides. So virtually, I welcome you to our organization located in Haridwar and to explore the research that we have been doing related to yoga over the last few years. We have 5 main areas of research. What are the physiological effects of yoga practices? And can we ask some very general questions using surveys, like what are the characteristics of a typical yoga practitioner? What are the benefits that people get? Are there negative outcomes? All this based on surveys conducted on large numbers of people. Then once we know the physiology of yoga, can we apply these understandings and these findings to see certain specific applications to improve overall life and well-being in both children and adults? Also, what are the health applications, both for actual diagnosed conditions as well as for a pre-clinical condition? In this case, I'm talking about obesity. And the 5th area and last area is positive psychology. So not just the improvement of everyday skills or managing disease, but can we actually generate positive feelings, what are called positive psychological constructs, like the sensation of or the feeling of being happy, eudaimonia, well-being, overall well-being, satisfaction with life, a feeling of gratitude, and so on. And from that, I will just end with a few seconds about the future areas that we are exploring. So coming first to the physiology of yoga practice, the way in which we have explored this over the years is looking at the descriptions of each of these practices based on the observations of the ancient sages of India, who after all had the best laboratory there ever was and documented the findings of their observations of the changes occurring in their bodies and their minds for all of us available in the traditional yoga texts. We take these descriptions of the effects of yoga practice from the traditional text and we try to explore them using present-day experimental techniques. So this could be, as shown in this slide, it could be imaging methods, it could be cellular level methods, and so on. But the important point is to try and use present-day techniques, sometimes very simple, sometimes very complex, to explore descriptions which have arisen about yoga thousands of years ago. We have had several examples through the years and asked questions such as, what are the effects of the headstand? Can alternate nostril breathing, or anulom vilom pranayama, really bring about a balance between the left analytical cerebral hemisphere and the right intuitive and creative cerebral hemisphere? And can the physiological assessments really find distinct differences between the 6th and 7th phases of the Ashtanga of yoga, Dharana and Dhyana? Are they distinctly different, or physiologically are they the same? Well, I'm not going to actually cover these questions now, though our research has covered them in the past. I'm going to look at one study which we did, which is a very simple study and a relatively recent one. Are pranayamas called cooling in the general understanding as well as the traditional texts really in actual fact cooling? So the example which I'll be taking up is called Shitali pranayama, which Shitali literally means cooling in Sanskrit. It is taken from an original word, Shital, which means soothing or cold. And in Hatha Yoga Pradipika, which is one of the excellent, very practical traditional texts, in chapter 2 and verse 57 to 58, there is a description of pranayama practice, this particular Shitali pranayama, which suggests that it can be cooling based on the description, that is, it reduces excess bile and corrects disorders of the spleen, works on fever. So this is the description mentioned in Hatha Yoga Pradipika, from which it is now largely called a cooling pranayama. You can see here across the world, Shitali is sort of synonymous with a cooling breath or a cooling pranayama. So in the laboratory, we actually investigated it with 17 healthy volunteers whose ages were very young, like they are teens and early adulthood, because they were all students. We wanted to select healthy people and who were at the same time experienced in the yoga practice. The study design actually included 4 sessions: Shitali, Shitkari, Pranayama, Shitkari being another cooling pranayama, which also, like Shitali, involves inhalation through the mouth. Normally in physiology, we say it is important to breathe in through the nose. So these 2 practices advocate breathing in through the mouth in specific ways, compared to the 3rd practice, breath awareness and lying down quietly. All 4 sessions were practiced in random order on 4 separate days at the same time of the day. So this is a study design which has been consistent through all our research, which is called the self as control. The same individual is tested in both experimental and controlled sessions on different days. The measurements which were chosen are definitely targeted to look at whether these practices are really cooling. So we used the auxiliary surface body temperature with a very sensitive sensor, which gives a reading as good as core temperature measurements. Also measurements using the open circuit analyzer for the metabolic variables to understand how many calories are being burnt, which is also an indicator of heat within the body. But then it's also important to have ambient heat. So we calculated the heat index in the room where the recordings were done to get an idea of ambient heat based on the temperature, humidity, and even ambient pressure readings. What did we find? We found that contrary to what one may expect, the actual body temperature readings were not the same, not less, but actually increased during both the pranayama practice. Well, there was a decrease after breath awareness and quiet lying when compared with the post-exercise states. So this was a very interesting finding, and we needed to really think what could be causing this rise in temperature during the pranayama practice. In a way, this was well supported by our oxygen consumption measurements, which actually showed an increase contrary to what we may expect during yoga practice, where it was 9% during Shitali and 7.6% during Shitkari. So something is being burnt in the body, which causes the temperature to rise. We'll come to what this means for us physiologically, but subjectively, the participants experienced increased calm and better relaxation. So it would appear that contrary to what we may expect, that is body temperature either being reduced or at least the same, it actually goes up because calories are being burned. So we may say that these practices which just involve sitting, either an Ardha Padmasana or any straight spine position, actually speed up the oxygen being consumed to a degree which could be comparable with mild exercise for people who need to be seated while exercising. But then what about the meaning of cooling? This shows us that sometimes when we extrapolate descriptions from the ancient texts, we actually need to be a little inventive and understand here that cooling could actually mean calmness, relaxation, and a cool mental state. So sometimes the physiological effects which come out of these kind of studies are interesting, a little different from what we may expect, but then understanding these effects in totality actually does not in any way contradict the descriptions, but gives them a more sort of whole and practical application. From this, I'll move on to the next area, survey-based research. We have been interested in understanding questions like, what are the characteristics of a yoga practitioner? Studies done in the US and Europe, in Canada and in Australia have often shown that a yoga practitioner is typically a middle-aged female, very fit, and with at least 17 years of education. So highly or tertiary education, yes, is present. So what is the characteristic of a yoga practitioner in India? While the yoga practitioners in other parts of the world were motivated by a thought that it would make them be physically fit and keep them in a state of good physical well-being. Let's see what the motive factors were to motivate the sample we assessed in India. So this was a large sample, and we had published it in 2017, collected in actual in-person survey, and we found that the yoga practitioners in India were both of both gender, but with a predominance of male practitioners. Young age, so they started right from the childhood right up to 40 years of age were a large number of the participants. And education too, possibly because they were younger, showed those who had completed just 10 years of education, as well as those with more than 12 years and even up to 17 years were present. But the large thrust was in younger age groups who had up to 10 or 12 years of education. What was the factor which motivated this population? Largely, this population were motivated, as the populations were in other parts of the world, to be physically fit. It was interesting also to note, though, that these persons were motivated to practice yoga because they believed that it would help them to be better in cognitive functions like attention, memory, and this could possibly be related to the fact that many of them were young and were still actively studying and wanted to do better in their studies. This is the characteristics of the sample. But what about the benefits of yoga practice? Are they the same in all parts of the world? What are the negative effects, if any, of yoga? So we looked at this through another survey which was completed and published this year, where we started out with 9,100 people. And based on the various inclusion criteria, which I put up here, like a minimum of 1 month experience of yoga, we even included children 10 years and above, because these were very eager to participate in the survey and were able to give accurate and sensible responses. And exclusion criteria was just those who had no prior experience of yoga. Our final sample consisted of over 3,135 people who had experience of yoga. What were the benefits that they reported? The most common benefits were a better physical fitness, an improvement in their mental state, that is the emotional state, with more positive emotions, and cognitive functions, especially attention and memory, which, if you would remember our prior survey, which I just mentioned in the previous slide, was a very strong motivator for people to practice yoga. So physical fitness, yes. Cognitive benefits also, which were strong motivators, appear to be the common benefits experienced by people practicing yoga. It's interesting to note that these benefits were reported by 94.5% of the respondents, slightly higher than respondents elsewhere in the world, though essentially these effects like physical fitness, better mental state, and improved cognitive functions are comparable to reports from other parts of the world. The adverse effects reported by participants related to yoga practice were few, just in 1.9% of the respondents. But of course, 1.9% is worth reporting. And this is one of the areas which has to be given due consideration in all yoga studies. And we are trying to increase our reporting of adverse effects, if any. The most common adverse effects are actually quite simple ones: soreness and pain, muscle injuries in a few cases, which do require thought and support, and fatigue. So this is just an example of the survey-based research. We also have some other studies where we collect the responses in surveys. Moving on, applications of yoga across the lifespan. So I would take up applications of yoga for children in this presentation. We did a randomized controlled trial of yoga for school children in Uttarakhand, in Haridwar. And this was completed and published in 2014. The study actually compared children who practiced yoga versus those who did physical activity and looked at least 4 types of assessments of them. Physical assessment, physical state assessments of physical well-being, their cognitive functions, emotional state, and the teachers' reports about their punctuality, behavior, and even their academic performance. The children, as I mentioned, there were 98 children randomized as 2 groups, a yoga group and a physical exercise group, where they were given 45 minutes of the practice, 5 days in a week for a 3-month period. Now, yoga in this particular study differed from physical exercise because the children were asked to be very relaxed, which was not emphasized for physical exercise, as well as to turn their awareness inwards into what was happening in their body, in their brain. Whereas in physical exercise, attention can be external. For example, physical exercise like running on a treadmill while being attentive to what's happening, not necessarily inside, but what's happening, for example, on a TV screen or listening to music. Whereas in yoga, it's all internal attention. So these, and of course, there is also a synchronization or attention given to the breath in the case of yoga. What are the results? At the end of 3 months, both groups had very comparable effects for their physical changes, their cognition, particularly assessed using a Stroop task, and behavior with a special emphasis on the self-esteem components and behavior overall, like punctuality and the way they interacted with peers and teachers. One difference which really was noticeable and worth noticing was in the yoga group, there was an improvement in their academic self-esteem. We felt that this was really worth noting because very often these kind of children who are like pre-teens in school have a lot of stress related to academic self-esteem. And sometimes it can be even extreme where children feel very threatened if they don't do well academically. So anything that can boost a child's self-esteem, especially academic self-esteem in school, is a good practice. And that's what we found with yoga. We've also done another study which looked at a school-based, very easy to give intervention, which is a yoga-based pranayama, where we found that just 18 minutes of the intervention given as a classroom-based practice could reduce state anxiety and improve their ability to sustain attention and to shift attention. And this practice is, while it is several pranayama practice, is largely based on Kapalabhati practice. We also look at yoga for certain clinical conditions, and I've specifically mentioned one here, that is Duchenne muscular dystrophy, which is hereditary. It's a genetic condition, not necessarily. And in this case, why I want to mention it here is that this particular study used yoga and Ayurveda over a 16-week period and found benefits not in the form of a cure. So this is something I want to emphasize. Sometimes the benefits don't translate into a total cure, but into an improvement. So the quality of life of these children, which often deteriorates very drastically or gradually, so that by the time a child is in the early adulthood or even earlier, they may be in a wheelchair, and of course it is sadly, ultimately fatal. So if the progression can be reduced, and also the quality of life of the child can be improved, it is a very good finding. And that is what we did find with yoga and Ayurveda. Not a cure, but an improvement in the overall quality of life, and the progression of the condition was appeared to be a little slow down. The other point is that the child was actually treated along with the mother, who got a chance to actually reduce the caregiver stress. This is just a simple example, one study, which I would like to say that you can sometimes combine yoga with other treatments, in this case Ayurveda, for better optimal effect. And sometimes in certain conditions, it's good to treat other members of the family, like the mother here, for caregiver stress, mother or father, whoever was taking care of the child. Moving on to adults in the workplace, so another application, something that we have looked at. I'm going to mention specific examples here. I think 2 examples. Yoga in schools. Now, the way a teacher feels really impacts their student in multiple students in multiple ways. This is something we looked at first. How does a teacher feel, and how does it impact their students? So a teacher who feels good, who's optimistic about their job and happy with themselves, definitely has a better effect on their students. Can we give a yoga program for teachers? So we did this for primary school teachers from northeastern states who had come to Patanjali Yoga, and we found that their mental well-being, overall mental well-being, as well as their levels of anxiety were significantly reduced after a very regulated yoga intervention over a month period. And they were compared with teachers from the exact schools who did not undergo yoga, but who stayed in their homes and continued with their routine teaching. We also had certain other benefits apart from the actual statistics and results, and that teachers felt more optimistic about being able to make a difference in children's lives. They also noted resolution of small problems like a difficulty in remaining standing in the classroom if that was what was required. And some schools where they used chalk, actual chalk and blackboard dusters, they reported that they no longer had so much irritation from the chalk. So there are a number of these kind of benefits as well. And these papers, in each case, where the journals where they're published and the references are mentioned on the slide. We also looked at another application of yoga for border security force personnel. We had over 200 people who were assessed in a very focused program, and they are all young men posted at the country's borders, where they actually had to guard and be very vigilant during this time. The problems that they faced were chiefly worry that their vigilance levels would reduce, and because of these high levels of vigilance, an inability to relax. So what we found was after just 9 days of intensive yoga, because that was all that could be spared in their very hectic and tight schedule, where it was an intensive program, 240 minutes of yoga per day. Their sleep was better, which is very important. They had even better vigilance, which was important for them to do their job well, and a reduction in their levels of anxiety. So we can see that from teaching, where the levels of anxiety and demand are quite different from border security force, we can see that workplace yoga, workplace wellness and yoga have a definite role. This is something which really we are interested in. Can we improve workplace wellness across diverse occupations through yoga practice? What about therapeutic? This is one of the areas which is best and very well and clearly worked out. Yoga in clinical applications. And we have done studies in this area as well. Yoga therapy for anxiety, for depression. How much should one practice? How long one should one practice? Is it the intensity of practice or the duration, which is important for anxiety and depression? What about low back pain? Is there a specific yoga module which can reduce the pain, improve the function, and even reduce other signs of arousal in people with low back pain? Can we manage hypertension, for example, through a very simple intervention, maybe one or more yoga practices? And post-traumatic stress disorder is something that we have studied at least in 2 occasions related to natural calamities. In one case, floods. I am now going to go on to not those conditions, but to a preclinical condition, central obesity, common in South Asia, where the abdominal girth is particularly high. And we have got studies to suggest that yoga helps in reducing central obesity. The central obesity could be of 2 types, subcutaneous fat as well as visceral fat. We have looked at a very preliminary level of visceral adipose tissue using magnetic resonance imaging techniques. This is a study which we attempted to begin, and that was pre-pandemic, and we hope to complete it sometime after the pandemic resolves. But why are we interested in visceral adipose tissue so specially? It's very dangerous because it is the part of the adipose tissue which is responsible for chronic inflammation through various substances that are secreted, as well as other problems like insulin resistance, as well as disturbance in satiety and feeding hormones or adipokines, which I'll be mentioning in a few minutes. For example, one of the satiety and feeding adipokines is leptin, which acts on the hypothalamus to suppress our appetite. So whenever we eat a certain amount, not only does our blood sugar rise, but also the rise in blood sugar has a sensor in the hypothalamus which tells us when to stop eating. Whether we pay attention to the sensor or not is important for our weight regulation. So sometimes, even when we have a satiation and we don't feel to eat anymore, a person may just continue eating, and that would result in obesity. the sensitizing to the sensor, as well as normalizing the leptin levels, is some of the effects that we see with yoga practice. So based on this, we actually launched in 2016 a nationwide campaign for the management of obesity through yoga, where we looked at 21 states, virtually all of them shown in the map here, except a few northeast states and the state of Kerala, where we were not able to involve people, though they were interested in the program for this particular program. It's always possible at a later stage, as well as 2 union territories. This is an ongoing campaign, and we actually now have the data for not only baseline and 3-month data, which I'm going to present now, but also what happens at 6 months, 9 months, and even 1 year after the study is, after the people start practicing yoga and after the study is launched. So on the whole, we can say that yoga helps to sustain weight loss. This is very important. Not only start practicing yoga, lose weight, but sustain the yoga practice and sustain the weight loss. How? By helping the person to reset that eating balance, not only to reach a point of satiety and remain there, not overeating, but also to select healthy food choices. These are some of the articles that have been published by us. And on the whole, we can say that yoga helps to reduce central obesity in 12 weeks. Now we also have the data for 12 months. Reduces the risk of cardiovascular events in 3 months, and helps to regulate the satiety hormone, the appetite suppressant, leptin, as well as, very important for the continued practice of yoga, gives people a better quality of life, a sense of a good body image, and positive psychological changes, which would really help to continue with the practice. So moving on, what are the future directions? And this really brings me to the 5th area, positive psychology constructs and yoga. This is one of the areas we are very interested in taking further by adding this physical practice to the philosophy of yoga and its principles. Can we look at how the yoga practice impacts the way a person feels? So it's very interesting that this particular meeting has well-being as its component, because we are interested in understanding the effect of yoga practice on eudaimonia, on hedonia even, on gratitude, on compassion, and so on. We've also looked at the trends in clinical research, and it's interesting to note that right from 1970s up to the present time, while there have been a number of RCTs, you can see it's shown here as blue line, the numbers actually reduced from 1991, whereas the numbers of systematic reviews keeps going up. We need a nice balance where we have people doing the original research to fuel excellent quality systematic reviews, and that's where we hope to do add to our existing activities of clinical trials, which preferably would be randomized. Also, adding research to all levels of yoga education. It's become increasingly apparent that people, whether they do a 1-month course out of interest, or people actually want to fuel their career through yoga knowledge, which would also be excellent. It's important that their level of, whatever their level of education, their knowledge about yoga is driven by facts. And in the last few years, I've actually mentioned here, I want to mention here, that books often give a summary of years of research, and it is important to not only involve researchers in bringing out books, but also for students to read the books.